Thank you for joining our town hall today. The COVID-19 pandemic has challenged every aspect of our lives. It has not only changed how we work, how we shop, and how we visit with family and friends, it has also impacted the healthcare of many and how we access healthcare services. Your support has allowed Milton District Hospital to act quickly in this changing environment. Your donations have enabled us to fund additional patient monitors, ventilators, and equipment to increase the testing capacity in our hospital's lab. These resources not only had an immediate impact on healthcare in our community, but will also continue to support patient care for years to come. We have received enormous support from our community and appreciate everyone's patience as we work to safely resume services. Our guests today are four well-known members of the Milton District Hospital leadership team. Janet Skupski, our Chief Operating Officer, Dr. Salman Khalid, the Chief of Emergency Services, Dr. Kevin Kwan, the Chief of Surgery, and Cheryl Collins, our Patient Care Manager for Medical Surgical Units. The format of our town hall will be very straightforward. Our speakers will each provide their remarks, and at the end of each speaker, I will be asking some questions that we have received from our donors during this pandemic. So let's get started. At this time, I would like to invite Janet to share some updates on Milton District Hospital's response to the pandemic. Janet?
Thanks, Helen. As you know, on March 15th, following direction from the Ministry of Health and the Chief Medical Officer of Health, Hospitals in Ontario began to decrease scheduled surgical and procedural work out of concern that our health system could be overwhelmed by COVID-19. We immediately took decisive action to keep our patients and staff safe. We were asked to reduce clinical work. That meant the postponement of elective surgeries and other non-urgent procedures to create capacity. We were also asked to identify extra spaces where care could be provided in our hospitals. We needed to reduce the number of people in our building. That meant temporarily saying goodbye to our volunteers and students and restricting visitors. This extremely difficult decision was made to protect our patients and healthcare workers, but we know it has been challenging for our patients and their loved ones. Our ramp down activities ensured that we were limiting and screening the number of people into our building to protect our patients and staff. We also established testing and assessment centers in each of our hospitals. And then, to assist with the turnaround time for test results, we purchased the equipment needed to do testing in-house. To date, we've seen more than 37,000 individuals in our testing and assessment centers and have been able to contribute to the provincial testing strategy. All three centers are operating at full capacity. No one is denied an appointment for a COVID-19 test. These were all necessary precautions in the face of a very serious public health risk. Fortunately, our organization was well positioned to respond to this global healthcare crisis, thanks to infrastructure investments that we have operationalized during recent years, including, of course, the Milton District Hospital expansion that was opened in October 2017. Although we had to make changes to the way our hospitals operate, we continued to provide essential services, such as emergency care and urgent surgeries. The surge of COVID-19 patients, particularly in our region, did not create the volumes forecasted by the province. Instead, the pandemic put a spotlight on the vulnerable populations in our community. I'm sure you remember hearing federal and provincial politicians say on a daily basis that the most vulnerable to this disease were residing in long-term care homes, retirement homes, and other congregate settings, and care for them was being really challenged. As this became increasingly apparent, we developed a plan to support the vulnerable population and went out into the community. Our support included partnering with the EMS teams to conduct COVID-19 mobile testing in 8 long-term care homes. We did approximately 800 tests. Creating a rapid support team to support on-site assessments at long-term care and retirement homes. Creating comprehensive support plans for these facilities, including on-site physician assessments, infection prevention and control education and coaching, nursing staff support of a full spectrum of resident care needs, on-site access to physiotherapists and physiotherapy assistants, and the admission of residents from these facilities to provide appropriate care of their medical needs. It's encouraging to see that the provincial government has launched a commission to examine the effect of the COVID-19 pandemic on long-term care homes.
So Janet, we have some questions from our community. There's been a lot of talk in the media and on social media about personal protective equipment, or PPE. We've heard about global shortages and community drives for PPE. Does Halton Healthcare and Milton District Hospital have the supplies it needs to deliver care while protecting patients and staff?
That's a great question, Helen, with an answer that changes on a day-to-day basis. PPE includes masks, face shields, eye protection, gowns, and gloves. Overall, yes, we have the supplies we need, but that doesn't mean that we aren't faced with shortages, just like everyone else. There is ongoing procurement via a number of different vendors, and there are channels for obtaining additional PPE if required through the provincial government. We also have processes in place and are very diligent about conserving our existing stocks of PPE. I think it's important for people to know that we monitor the inventory of our personal protective equipment on a daily basis so that we always know what we have on hand and where we might be running into challenges. Thanks to the Foundation for assisting with donations of PPE, approximately 170,000 pieces of PPE have been donated from our community since March. And generous donors have made financial contribution toward the purchase of PPE and other important equipment. Today, we continue to move forward cautiously. Everyone must continue to pass active screening before entering our facilities and are asked to follow our guidelines, including frequent hand cleaning and maintaining physical distancing. And of course, everyone entering our hospitals are asked to wear a mask. While hospitals and a handful of other settings are exempt from the regional masking bylaw, which came into effect in July, we made the decision to move forward with a plan to strongly encourage everyone to wear a mask or face covering when entering our hospitals and off-site locations. This is in keeping with the current practices at many of our neighboring hospitals. There's no doubt that we've seen a tremendous change in how we go about our daily tasks as we continue to fulfill our vision of providing exemplary patient experiences always, especially during these unprecedented times. I can't tell you how proud we are of the physicians, staff, and leaders who've been supporting our COVID-19 response plan to protect our community.
Thank you, Janet. Now I'd like to invite Dr. Khalid to bring us an update on the emergency department experience during the pandemic.
Thank you. I'm grateful for the opportunity to be here to support our community. In March, when the ministry issued directives to the hospitals to ramp down services in the midst of the hourly news reports of COVID-19 and the daily updates of this new disease spreading around the world, I never expected that our emergency department would become so quiet. It was a phenomenon that occurred across the province as the pandemic spread, and so did the fear of coming to the hospital. And sadly, those who needed care, we found, delayed coming to the hospital, and some instances seriously impacted their recovery. We saw patients who had heart attacks at home and didn't visit the hospital. We saw patients having strokes who we saw several weeks later with life-changing disabilities simply because they didn't seek timely care in our emergency department. Now, even though the provincial government is providing daily reports on the number of cases and deaths of individuals who contracted COVID-19, what still has yet to be measured is the number of indirect consequences on the lives of people who have suffered illnesses and even death indirectly as a result of COVID-19. It's an extremely sad and sobering thought, especially when we realize that hospitals, even in the peak of this once-in-a-lifetime pandemic, were perhaps the safest because we really were prepared. Hospitals are built to respond to many crises, and a pandemic is one of them. We and our team have taken great lengths to prepare our emergency department to fight COVID-19. Our COVID-19 pandemic response plan was created with a view to ensure all of our 3 hospitals acted as one system and mounted a coordinated response to what we believed would be a surge of COVID-19 patients. Our hospital is designed to support the appropriate care of patients with contagious diseases. We have negative pressure rooms, personal protective equipment. We've divided our zones in our hospital to better serve patients with suspected COVID and non-COVID. We have socially distanced our waiting areas. We've created a flow and a triage area so that keeping people as separate as possible. We have the capacity to shut down our facilities to screen everyone who comes in. So I just wanted to give everyone the reassurance that we are prepared to deal with whatever comes in during this pandemic.
Dr. Khalid, just a quick question from our community. What's a key lesson you've learned from the COVID pandemic that you'd like to share with us?
Okay. Thank you for the question. I think that's a really, really important question to ask and reflect on. Our department has been reflecting on this important question over the last several weeks as we use these lessons to prepare for the second wave of the pandemic. I think, number one, we've learned just how important the generous donations of the members of our community are to providing care to our sickest patients, relying on these donations to procure necessary equipment in order to support our services to the community. So I just wanted to say thank you to our community members for supporting us during this time. And number two, I've been fortunate to work here for the last 10 years. And I think one of the main reasons why I'm here is because I find this to be a very unique group of staff dedicated to serving patients. Now, I can't say that I learned anything new about our staff, but I'll say that this pandemic has reaffirmed what I already believed, that this was a very special place to work. I've seen people that I consider my friends sacrifice time with their families and loved ones, putting their own lives in significant risk in order to care for the most vulnerable members of our community. So I'm not surprised in the least by it, but the pandemic has served as an excellent reminder of just how dedicated and willing to serve all of our staff are. Number three, I think with great crisis breeds great opportunity. And what I've seen also is that services and departments that don't normally necessarily collaborate with each other come together to collaborate on different projects to support each other greatly. The services are too many to name, whether it's surgical services, internal medicine, the emergency department, pediatrics, obstetrics and gynecology, all of our, I'm only naming a few of them, but we've all come together to look at the greater goal of how we can actually best serve our patients. And this collaboration is something that I've experienced on a greater level for the first time. And I'm in awe of how well we've all worked together as a group.
Dr. Khalid, is there anything you'd like to share with our community in closing?
I think what myself and I think all members of our emergency department want the community to know is that the emergency department is a safe place. We are well prepared for the pandemic. We are designed to treat all different types of conditions, whether it's with suspected COVID or any other life-threatening emergency or even minor illness that you feel needs treatment. So I just want to reiterate, please do not delay in seeking care at our emergency department. We're here to help you, and we do want to serve you.
Thank you, Dr. Khalid. I'd like to now invite Dr. Kwan to share some insights in the work currently underway to restart the programs and services here at our hospital. Dr. Kwan?
Thank you, Helen, for having me. So returning to our pre-pandemic operations is at the top of everyone's mind. Our COVID-19 pandemic restart plan was developed based on a set of guiding principles, assumptions, and key strategic clinical directives to protect our patients and people. Our teams are working hard as they navigate the complex work associated with returning to pre-pandemic levels of clinical activity and patient volumes. We had to demonstrate to the government that we met the requirement to restart, which included our hospitals having a stable rate of COVID-19 cases and are not an outbreak, our communities having a manageable level or sustained decline in COVID-19 cases, our hospitals having an adequate bed capacity of inpatient as well as staffing resources, and we have to ensure that we have the stable supply of personal protective equipment and critical medications. We received approval for Phase 1 restart in mid-June, and as of August 1st, we have now entered Phase 3 of our restart plan. We have been very mindful not to rush this process, and it has been very carefully thought out with a gradual increase in clinical services. Many people in our community have been waiting for hospitals to reschedule hospital tests, surgeries, and procedures that were delayed due to the pandemic. Currently, we have safely begun to provide non-urgent services again. We have restarted deferred diagnostic imaging exams, inpatient and outpatient surgical procedures, outpatient cardiorespiratory testing, mental health counseling.
And here's a question for you from one of our donors. Is there anything specific I should do to prepare for surgery?
Yeah, that's a great question. We've done a few things. The first thing is that we've changed our pre-surgery appointments so that it is closer to the time of surgery, and it will now also include a COVID-19 test where appropriate. We are also recommending that patients self-isolate and limit contact where possible, while always following public health guidelines such as cleaning your hands frequently, practicing physical distancing, and wearing a mask in public when physical distancing is not possible. On the day of surgery, you and your support person will be screened upon arrival to the hospital and will be encouraged to wear a mask. This is a positive step forward, but one that we need to approach with caution to ensure that ongoing safety of our patients, staff, and physicians are maintained. It is important that we are conservative in our approach to restarting. Daily and weekly monitoring of key indicators, including overall occupancy of the hospital, will continue. While we are relieved to be able to provide additional services, we need to be ready to respond to any resurgence of COVID-19 in our community.
And one final question. How long will it take to get caught up with the surgeries and procedures that were postponed?
So we are gradually reintroducing clinical work based on clinical need, but we will need to be cautious. We will continue to provide urgent, emergent, and cancer services as we have been throughout the entire pandemic. And we will continue as we resume elective surgeries and procedures. We have a strategy to maintain flexibility in preparation for a sudden increase in cases, whether in hospital or in the community, and require us to reduce our clinical volumes once again. We are working on a recovery plan that will address the backlog of canceled surgeries and procedures and will most likely take more than a few weeks to months to recover. We don't have an exact time frame because the number of variables that can impact this, but we ask for everyone's patience as we return to a more normal schedule. If you have had surgery canceled or postponed and you feel that your situation is becoming urgent, please contact your physician or surgeon.
Well, thank you for sharing that. Is there anything else you'd like to add?
I would just like to echo the sentiments of my colleagues in sharing the gratitude that we have for the ongoing support from all of you, our community, during the pandemic and years before that, of our hospital and our foundation. We are always very grateful and thank you.
Thank you, Dr. Kwan. I'd like to now ask Cheryl Collins to share some information about visiting restrictions and the changes in our hospital over the past 6 months. Cheryl?
Thank you. We know that the visiting restrictions implemented at Halton Healthcare during the COVID-19 pandemic have had a significant impact on our patients and their families. While some limited visits were permitted on compassionate grounds and our virtual visiting program was largely successful, there is no comparison to an in-person visit from a loved one. As we begin to resume clinical services, we are also gradually welcoming visitors back to our hospitals. This will not be a complete return to normal for visitors, and for the safety of everyone will need to be a very gradual process. There are no two patients who come to our hospital whose circumstances are exactly the same, and throughout the pandemic we have done our best to accommodate compassionate visits for all of those with exceptional circumstances. We've had to make some very difficult decisions and implement new policies and procedures for the safety of our patients and healthcare workers. Last month, we started allowing one essential visitor to accompany patients in the emergency department. This was followed with welcoming a designated essential visitor for our long-stay patients. The family presence plan or visiting policy is flexible in such a way that we can return to a previous phase should the circumstance require, and exceptions for visitors and care partners continue to be considered and approved on a case-by-case basis. Visitors to the hospitals are required to book a time for their visit, and when they arrive at the hospital, they will be required to complete the screening process, wear a mask at all times, and maintain physical distancing within the hospital. We will continue to monitor the visiting policy and make adjustments as required. The best place to look up information for our visiting policy is on the Halton Healthcare website. please click on the COVID-19 section. From there, you'll find information on the visiting guidelines, as well as information about our virtual visiting program, and as well the Email a Patient program.
Are all hospital staff tested for COVID-19?
That's a great question. At this point in time, it is not mandatory for all hospital staff to be tested for COVID-19. All staff who are interacting with patients or working in patient care areas are wearing the appropriate personal protective equipment to ensure their protection from the virus. Staff members or physicians who develop symptoms are required to be tested and follow appropriate directions regarding monitoring their symptoms. As per the direction from the government, any individual, including healthcare workers, is able to be tested if they wish, but it is not something that is mandated.
Well, that's wonderful. Are there any other final thoughts you'd like to share?
On behalf of Halton Healthcare, thank you for doing your part by staying home, staying safe, and practicing physical distancing. We are all in this together.
Thank you, Cheryl. Thank you to all our panel for sharing their insights with us today. As a new normal continues to evolve, the Foundation team is adjusting how we fundraise for the priority needs of our hospital. Now more than ever, it is important that our hospital is well equipped to meet the healthcare needs of our community. I hope that we can count on your continued support. There is no doubt that the pandemic has shifted our reality seemingly overnight, yet our community has continued to show its resilience to move forward in this journey. I believe that it has been the commitment of our donors that has made the difference here at MDH. It is your support that allowed our hospital to effectively respond to this unprecedented challenge. I've often wondered what it is that makes this community so special. I can see now that there's a desire among many people to go out of their way to help others. I see this in individual donors, businesses, community partners, and even in the children who fundraise for our hospital. It is inspiring, and I am proud to be part of it. Thank you.